So you missed your cycle. Could you be pregnant? Well, the proof is in a urine pregnancy test, but that also could be false positive or false negative sometimes, so we cannot predict on that. You should know certain signs and symptoms of early pregnancy. The classical signs of early pregnancy are usually a missed cycle. So if you miss your period by a period of 1 week, please get a urine pregnancy test done. It should be done in the first urine sample because the concentration of beta-HCG, that is the hormone that is produced in pregnancy, is higher. Then comes swollen breast, tender breast, even the nipples may be tender. Then you may have increased frequency of urination because the uterus increases in size and it presses onto your bladder. You can have nausea, vomiting, and moodiness, mood swings which come along because of all your hormonal changes. Less obvious signs also include a feeling of lethargy or you don't feel like doing anything at all. You may also have bloating, constipation, and you might have a little bit of spotting which can come out as brown discharge. And this usually is known as implantation bleed, and it is seen approximately where your period is supposed to come. And then it can stop on its own. We cannot predict pregnancy just by knowing the symptoms because some women may have all these symptoms but not be pregnant, whereas the other women may have absolutely no symptoms but they come to us with a positive pregnancy. I still get patients who come to me in the 3rd month of pregnancy. Please understand that the first 3 months is very important in the development of the fetus. So in case you have any kind of diabetic problem or a thyroid problem or a hypertensive problem, this can affect the baby, and you should take folic acid so that it helps in the development of the nervous system. So you do a urine pregnancy test and it turns out to be positive. Well, congratulations. So the first thing that you do is go get an antenatal checkup because you will need to do a set of blood and urine tests and make sure when to schedule your early pregnancy scan. But at the same time, because of the lockdown and because people are taking it very lightly, people are having unwanted pregnancies, and this is not the way how to go about it because you have a lot of options to prevent a pregnancy. So use the right contraception. So I get a lot of patients who actually come in and say that I've Googled this and this is what it says. So you cannot diagnose your pregnancy just by a Google search. 100% confirmation can be done only with a beta-HCG blood test. And even that just means that you are pregnant. That means a pregnancy is somewhere in your body, and it does not mean that it's inside the uterus. So an ultrasound scan at a particular value at which the beta-HCG reaches, only then we can find out whether it is an intrauterine pregnancy or an extrauterine pregnancy and treat you accordingly. Pre-menstrual symptoms and early pregnancy symptoms can probably be alike. So don't get confused with it and go get checked by a doctor to confirm your pregnancy.